Welcome to the Fresh Steps podcast, where we have real talk about the business, beauty, and health of your feet. I am your host, April Moore, certified medical nail technician, advanced foot care specialist, and owner of Fresh Steps Medical Foot and Nail Spa in McKinney, Texas. Hello, and thanks for joining this episode of the Fresh Steps podcast, where we have real talk about the business, beauty, and health of your feet. We are in the month of November 2020, and November is Diabetes Awareness Month. So I wanted to take this episode of the podcast to talk about diabetic foot health and how we can help our diabetic clients take better care of their feet. But I wanted to start off with two experiences that I had in my salon taking care of diabetics. And very, very, very important for those of you who have family members that are diabetics. So I had a client, a daughter who scheduled a pedicure for her mom. They were Hispanic. Their first language was Spanish. And so for the mom, there was a little language barrier. But the daughter spoke very good English. And so she brought the mom in, and I have them fill out their intake form. And I noticed as the mom was taking off her shoes that I saw blood in her shoe. And what caught my attention is that it looked like it was fresh blood. And so and the thing is, when you're looking at somebody's feet from the top, you can't see what's going on at the bottom of their foot. And so I put her in the chair, lift her up, and asked her, did she know that her foot was bleeding? And she said, oh, I just fell, like shrugging it off like it's nothing. So she did have neuropathy, which means that for a diabetic that has neuropathy in their foot, they really have no feeling at the bottom of their foot. So she hadn't realized that what she had was an ulcer on the bottom of her foot that she busted somehow and caused it to bleed. And so what I had to explain to the daughter and tried to explain to the mom is that, one, I cannot service you because you're bleeding. And two, because you're diabetic, you really need to go to the emergency room like right now. Do not pass go. Do not collect $200. Go straight to the emergency room and have this looked at. Because the thing with diabetics is that they don't tend to heal as fast and as easy as a normal person because their system is already compromised. And so the other part of that is if you have an open wound or ulcer or whatever, you're bleeding, that is an easy entry for infection. And for diabetics, infection can lead to amputation of either toes, foot, or the lower half of your leg. And it can even be worse, but I think that's bad enough. I think we can stop there. So what I explained to her was that, I've lowered her from the chair and I needed her to go straight to the emergency room. It seemed as if the daughter did understand the severity of what I was trying to explain. I reached out to my supervising doctor, and we were both on the same page that she needed to go directly to the emergency room. It was a Saturday. The doctor's office wasn't open. So, but what concerned me is that when she got down from the chair, she looked at me and she said, so you're not going to do my pedicure? And unfortunately, I had to say, no, ma'am. No, ma'am. Not only can I not do your pedicure, but you cannot come back for a pedicure until you have a clean bill of health. And it was her birthday, and I know that was very disappointing. And I think it's just my assumption from the language barrier that she really did not understand the severity of what was going on with her being diabetic and having an open ulcer at the bottom of her foot. And so I did try to check up on her a couple of days later. I didn't get a response. So I'm just really hoping that her daughter understood the severity and took her directly to the emergency room. being when I received my certification as a medical nail tech, to receive that certification, you have to work under a podiatrist, intern under a podiatrist. So I saw several of these, and the most amazing part to me about having a diabetic ulcer is when the doctor cleans it out without using any type of numbing medicine or anything. And so, although it didn't bother me to see them doing that, what bothered me the most is looking at this client and thinking to myself, you don't feel any of that? And no, they don't feel anything, which is the most dangerous part of all of this, is that if you're diabetic, you have neuropathy at the bottom of your foot. If you step on a rock, glass, pin, needle, anything, you don't feel it. And you can go on with that in your foot and potentially set up an infection right away. And so that really concerned me, that the fact that she still wanted a pedicure even after explaining that she really needed to go to the emergency room. So I just hope they went. Another case that I had that came into my salon is a young lady. She was an amputee. She had actually just lost the lower half of her leg. She was a young woman. She was a diabetic. She had a history of diabetes in her family. She understood all the precautions, which makes this such a emotional story, because she said, I thought I had done everything right. Like, I checked my feed, I made sure everything was okay. She hadn't had a pedicure in about 2 years because she did have an ulcer, and she was waiting on it to heal, and it was starting. And the thing about diabetics is that it takes them a little longer to heal than a normal person. I don't know if I said that, but so she was allowing it to heal. She tried to go get a pedicure. She told her pedicurist, we're just going to work on one foot, just leave the other foot alone, it's healing good. She went to the doctor. Doctor cleaned it up or something, but for some reason the doctor told her she needed to see the surgeon, the foot surgeon, for some reason. And the surgeon was on vacation for a week. And so she was like the first appointment when the surgeon came back. And literally from her appointment, she had to go and have her, it started off being a toe amputated, I believe, and then it went from the foot to the lower half of her leg. All within a blink of an eye. And that's the severity of what can happen with diabetics. And so the fact that she said she's aware of everything, she did everything she could, and this still happened. And she was a young woman, and she had her prosthetics, so she was just getting around and getting out of physical therapy, learning to use. So she was very new at this. We're in the middle of a pandemic, and I think she had her surgery around January, February, and she actually came to see me in like June. And so she was just kind of getting used to just the whole concept of being without the lower half of her leg and having to walk on a prosthetic. But the reality is she thought she did everything right. And even in trying to do everything right, she still lost her leg. So just think about the people who aren't even paying attention. And so my heart just goes out to her, because she was still a very young woman, and to have this experience when you're trying to do right, So I wanted to share those two experiences with you, just to kind of set the tone of how important diabetic foot care is for if you're diabetic, if you have a loved one, mother, father, grandparents that are diabetic. It is so important that someone, if they aren't able to do it themselves, if you're not able to do it yourself, that someone is checking their feet, the bottom of their feet. They're getting regular doctor visits to a podiatrist so they can check for neuropathy, and just making sure that their overall foot health is good. And so I wanted to give you one, two, three, four, five. I think it's 5 tips I have here on what diabetics can do to just kind of help maintain good foot health. The first thing is to wash and dry your feet daily. Making sure you touch your feet, feel your feet will help you to make sure that there's nothing going on the bottom of your feet, that you still have the feeling in your feet. Because the thing about it is it doesn't give you a warning sign that you can't feel anything. Well, there are some symptoms like tingling and things like that, but when it happens, you normally don't know. It just kind of happens or gradually happens, and you don't really pay attention to it. The next thing is to examine your feet each day. So again, that goes back, if you're washing and drying your feet daily, that means you're looking at your feet daily. So each day, make sure that you give your feet some type of attention. And then you want to take care of your toenails. Make sure that your toenails aren't getting long, that they stay clean and manicured, so that they're growing out properly. You're not developing any type of ingrown toenails or pincer nails, involuted nails, things like that. So keeping your toenails cut and manicured. The next thing is, number 4 is be careful when exercising. Again, if we're not checking the bottom of our feet, if we're not checking for feeling in our feet, if we're exercising, not paying attention, things can happen. So just be careful when exercising. And the 5th tip I have for you is to protect your feet with shoes and socks. Please, please, please. Again, we don't want you to step on any type of nails, glass, rocks, anything like that. So try not to go anywhere barefoot. And again, make sure that you are examining and touching your feet daily and keeping them clean. The other thing, I didn't have this on here, I'm surprised I didn't because I'm big on this, is moisturize. Moisturize, moisturize, moisturize. The thing about our feet is that the skin on our feet is much thicker than the skin on the rest of our body. It's our foundation. And so what you need to do is make sure that you're moisturizing your feet at least twice daily, with a cream or moisturizer that is made to penetrate the feet and hold in the moisture. The reason being is that dry feet will crack. They will get callous and they will crack, and infection can set in those cracks. And what we want to avoid more than anything is getting an infection in the feet for diabetes and for anybody else. So if you notice that your feet are dry and that you're using a lotion or moisturizer on your feet, and after a couple of hours you look at your feet and it still looks dry, then that's not the right thing. Vaseline is not a great option. When you're using oils, make sure you're using an oil that has a carrier oil that will penetrate. It's not good for the oil to sit on top of the skin. You want it to penetrate the skin to hold in the moisture. So definitely look for products. I do have products that I use. So if you're in the McKinney area and you need a foot care, especially if you're diabetic, please look us up, Fresh Steps Medical Foot and Nail Spa, and come in and check us out. But for our nail techs, please make sure that you are educating your clients, that you are talking to your clients, that you are giving them the information to help them take better care of their feet. And not only that, that you have retail products that they can go home and maintain their pedicure, that they can go home and moisturize their feet, that they have a good product that will help to maintain that moisture, so that their feet aren't drying out. So again, if you have a loved one, if you're diabetic yourself, if you have a loved one, make sure that you are taking care of your feet. Make sure that you have a podiatrist that you see on a regular basis, at least once a year, to have your feet checked, more often if you have other issues. But that's what I wanted to leave you all with today, with this being the month of November, and it's Diabetes Awareness Month. Please, please, please check on your loved ones. Make sure that someone is checking on their feet, that their toes are manicured. and that their feet have been moisturized. Those are the key points that I wanted to leave you with. And I wanted to thank you for joining us on this episode of the Fresh Steps podcast, where we have real talk about the beauty, health, and the business, beauty, and health of your feet. It's been a long day, y'all. Thanks again. Bye bye. Thanks for listening to this episode of the Fresh Steps podcast. Real talk about the business, beauty, and health of your feet. Don't forget to like us on Facebook, follow us on Instagram, subscribe to our YouTube channel, Fresh Steps Medical Foot and Nail Spa, and have an amazing day.